David Alaba of Real Madrid suffered a very severe looking knee injury today where we saw him plant with that left foot and what looked like that left knee just buckle inwards. At the time of this video, we don't know the exact diagnosis that Alaba is dealing with. However, that position that his knee went into is known as dynamic knee valgus, and it's extremely risky for the knee. So with today's video, we're going to go over the specific mechanics of dynamic knee valgus and the relevant structures that are affected when a person goes into this position. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they are a little bit easier to understand. I also go over the relevant anatomy of those injuries as well as what that person should expect when coming to rehab. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. So we see here on the injury video that as Alaba is running, he's going to plant with that left foot being slightly externally rotated. Then that knee is going to cave inwards. Here I have a model of the knee joint, and so the knee joint is formed up by the femur, also known as the thigh bone, that's going to come down and form the top portion here. Then as we look at the bottom portion of the knee, we have the tibia, also known as the shin bone, that's going to come up and form the bottom portion of the knee. And then as we rotate the model slightly laterally or towards the outside, we have the fibula bone. There are 4 ligaments in the knee that contribute to overall knee stability. The first one being that anterior cruciate ligament, also known as the ACL for short, located right in through here. As we flip the model medially or towards the inside portion of the knee, we have the medial collateral ligament, also known as the MCL. Then we flip the model laterally or towards the outside, we have the lateral collateral ligament, also known as the LCL. And finally, as we flip the model towards the back here, we have the posterior cruciate ligament, also known as the PCL for short. And there are also 2 other structures that are located within the knee joint. They are the medial and lateral meniscus. You can think of these 2 structures essentially as shock absorbers between the femur and the tibia bones. So let's talk about what exactly the dynamic knee valgus position is. Essentially, when somebody goes into dynamic knee valgus, this is essentially when we see a person that's going to externally rotate their lower limb, followed by internally rotating. And when you do this, you are essentially putting a lot of rotational stress going through the knee joint. And let's take a closer look as I do that. So as I do that here, you can see that as I'm putting all of that rotational stress going through that knee joint, that is essentially stressing a lot of those ligaments that contribute to overall knee stability, particularly that ACL. And this is because the ACL has a couple functions. The first function of the ACL is that it's going to prevent any sort of anterior translation, also known as anterior slipping of that tibia, as well as it's going to provide a rotational stability to that knee joint. So anytime we see a person go into a dynamic knee valgus and put a lot of rotational stress going through the knee where it looks like that knee just caves inwards very awkwardly, they are absolutely at risk, unfortunately, for an ACL tear. Another structure that's especially at risk in this position, of course, is that MCL. And this is because anytime somebody is going into that dynamic knee valgus position, they're going to get a force going through the knee that essentially wants to separate that interior or medial compartment. And so anytime you're going to get that dynamic knee valgus and you're trying to separate that, that's going to stress that MCL because that's exactly what it prevents. And finally, any sort of that force going through the knee can also stress the medial meniscus. In really bad case scenarios, it can affect all 3 of these structures. But once again, as of right now, we don't know exactly what he is dealing with. We just know that he left with a very severe looking knee injury. Now there is an in the clinic or on the field test that we can do to determine if somebody is suffering an ACL injury and an MCL injury. The first one for the ACL is known as a Lockmans Test. And so what we're going to do is we're going to take the person's leg, we're going to stabilize that femur, and we're essentially just going to pull on that tibia. And when we do this, we're going to compare this to the other side. And we want to see if the affected side feels any more lax than the non-affected side. Another test that we're going to do for the MCL specifically, this is known as a Valgus Test. And so what we're going to do here, we're going to stabilize the person's leg. And when we do this, we're going to provide a valgus force coming from the outside coming inwards. As we do this, this of course is going to stress that MCL in through here. We're comparing to the non-affected side. We want to see if this reproduces pain and or laxity. And both of these tests are going to give us an idea as to whether or not we are dealing with an injury to one or both of those ligaments. The gold standard, of course, is going to be that MRI, and this is going to take me into our grading system. In a grade 1 ligament injury, this is where we're getting stretching of that affected ligament. In a grade 2, this is where we're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. Obviously, the most severe scenario here is going to be a full rupture of that ACL, and the least severe scenario is going to just be some stretching, more of a lower grade sprain of an affected ligament. So we wish David Alaba the best of luck moving forward. We hope that we get results of his MRI and it shows more along the lines of that lower grade sprain. But once I hear that information, I'll be sure to update everybody in the comment section. Also, if you happen to hear it first, please feel free to update everybody as well. Thank you so much for tuning into my channel today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists of some of the other injuries that I've talked about in the past so that you can watch some of those. Thank you once again for tuning in, and I'll see you next time.